Welcome back. And it's my pleasure now to introduce you to the second showcase today, and to Cliff Kirby, who is the Chief Executive of NeedleSmart, a business that was originally created for health and safety to destroy needles from syringes, but pivoted during the pandemic to evolve to a digital vaccination system. So over to Cliff.
Vaccination system, DVS. Before we start talking more about DVS specifically, I'll give you a little information on the company itself. NeedleSmart is not a new entrant to the market as a result of the COVID pandemic. We are a business been around for a number of years. We've been through an investment round, and we've taken our product from concept and initial patent right through to an IP portfolio and product range. Specifically, we have a pro product which focuses around the needles that are typically used in the vaccination market. That product went to market in November of 2019 in a non-smart capacity, so that was focusing on needle stick injury reduction and sharp waste cost reduction. We also have a handheld device which focuses on the smaller range of needles, insulin pens and insulin needles typically for the home environment. That product is still going through development and is currently on pause while we continue our DVS journey to launch for the oncoming mass vaccination campaign. A little of the company here really. As you can see, from 2008, the original concept of NeedleSmart was born, and that was an invention and innovation that was delivered on an engineering front by myself and some friends in the first instance. And then you can see that we've rolled it through from 2015 onwards to develop it into a platform capable of growing in both size, scale, and helping support a large global healthcare infrastructure. So now I'd like to focus a little more on DVS. So DVS standing for Digital Vaccination System. It is a system that NeedleSmart owns entirely, from the IP that exists within the product itself to the software that sits behind the product in order to deliver a mass vaccination campaign. As we enter the mass vaccination campaign, we have determined there are 4 key questions that will need to be answered. Who administered the vaccine? Who was vaccinated? What vaccine did they receive? And when were they vaccinated? So as we look at that in terms of scale, we believe that all current protocols will fail in the event of a mass vaccination campaign. So we've taken a 4-pronged approach to how NeedleSmart and DVS will attack this problem. First, a little bit about the technology itself. NeedleSmart as a product will take a standard hypodermic needle, heat it to 1300 degrees in approximately half a second or less. As the needle itself is just about to melt, the sensors within the technology will squash the needle, rather accelerate an electrode pass up the needle and squash it into a small ball at the end of the plastic lure, thus rendering it a safe sphere at the end of the plastic syringe. A couple of points around that are that what is left is first and foremost not a sharp. By definition, it is safe, it is sterile, and it has been clinically proven that there are no virus or bacteria left in the residual safe sphere. That deals with post-procedural needle stick injuries, which can represent up to 25% of the needle stick injury marketplace and can save approximately 50% of the sharps disposal costs. So about digital vaccination system. We think that we've developed a system that is capable of en masse deploying and managing a mass vaccination campaign and is complementary to any or all existing software platforms or in-house processes that may exist. Our process, we believe, is a simple one. We see it as simple, we see it as secure, swift, and safe. All of those processes we have led from the start being end user centric and adding maximum value to the clinical experience, so that our logic path being the best route to the marketplace is to add maximum value in the vaccination room. Talking about our process specifically, the patient itself and how it would work. So first and foremost, how would the product actually administer a vaccine? We have a very well-developed system within our app. So we are digital led. Our application is at the front end, a user interface for the patient or customer. And at the back end is a complete architecture for a client to manage and operate a mass vaccination campaign. I'll talk about that a little more in a moment, but I'll address the issue around how a patient takes part in the DVS process. So we don't ask for a deep dive into someone's personal medical records. What we ask for is name, address, date of birth, and a reference number. Perhaps that reference number is an NHS number or an insurance number. The person registers with the system. This can be done via an app, or it can be done via an online profile, or indeed via a third party, such as a GP's practice who may do it on behalf of a number of patients. That's all of the data that we require to bring the person into the NeedleSmart world. Within that onboarding process, the individual carries out a vaccination checklist to ensure that they are eligible for a vaccine, and that will create a go/not-go gate for vaccination within the clinic itself. The patient now, assuming that all of that happened, is now selecting a time slot and selecting a vaccination centre, and they are onboarded to the system ready for vaccination. They arrive, they are registered, and this is where the NeedleSmart administration side of the app becomes important, by the clinician side of the app, which will bring them into the system by a QR code verification and a photo verification, which has happened during the onboarding process. It's important to note that the actual DVS software itself has the capability behind the physical app, the user interface aspect, of building out and upwards an entire mass vaccination campaign, so that all of the schedules and the slots and the booking facilities can be managed from within the app, or indeed be complementary to an already embedded booking system. Full reporting is available at each level of the NeedleSmart app, and different levels of administration available through that process. So back into the vaccination room, the patient's been onboarded. The clinician now scans the vaccine, which again, we are taking information from which we consider essential, which is who manufactured the vaccine, what is it, the expiry date, and the batch number. Now, while we're all focused very heavily on how we deal with the COVID-19 mass vaccination campaign, there are clearly many more applications for NeedleSmart post COVID-19 mass vaccination. And in real terms, what we are doing is creating a compliance event, i.e. a physical transaction, which sends the data into the digital world. So the individual will then be vaccinated in exactly the way that they would always be vaccinated, with standard protocols, standard needles, standard syringes or pre-fills. And then as the healthcare professional destroys the needle within the NeedleSmart device, you can see that on the right-hand side of the screen, the needle goes inside the device and the physician presses once. That will destroy the needle to create the safe sphere, which I've described previously. That safe sphere is generated in the room. As that happens, the data transmits to a secure location. That can be a centralized cloud, it can be direct to a hospital facility. What we have done is we have moved it instantly, and we have removed a very significant administration process in the middle of that. As that data is transmitted, let's use the example of a secure cloud storage. That data is then virgin data. We believe it's difficult to grab that any closer to the point of vaccination, and that can be used for onward processing, which I'll talk about on the next slide. So what do we see as our advantages? As you look at the mass vaccination campaign, we've spoken to a large number of healthcare professionals who are already embedded in the vaccination space. It's widely accepted that 50% of their time is spent on administration in the vaccination process, whether that's bringing the person into the vaccination or whether that's after the event and making sure that the correct vaccination code meets with the individual's record. Keen to point out that that does not include upstream administration that may happen with paper-based filing systems where another administration department is going to have to take ownership of actually recording that. What we believe we've done is we've removed and decreased the administration time by around about 100%, which is worth approximately 50% of the vaccination time. As such, allowing more processed vaccinations to happen in a quicker manner and a more compliant manner, in the fact that every time you destroy the needle, you are actually sending a record, so you get a physical timestamp. Which brings me to the next point, the secure digital compliance record that we create. Every time we destroy a needle, there is a unique code that is created. The unique code is a time and date stamp and is a unique identifier from each one of the Needle Smart suites. So it is very difficult to understand what that code is or looks like, and it is embedded behind each and every record. So if there is ever the situation where a provider needs to take a second look at a vaccination record, we are able to provide them, while we're not holding people's information, we are able to provide them with a reference number from the device at any given point in time. As we look at that now, that generates a record that goes up to a cloud. What we've done is created a virgin data record, and that virgin data record could be used for a number of things. It can be used for a health passport, it could be used for pushing straight back to someone's more complete health records, or it could be used to trigger an automated supply chain. The final point, of course, is it can be used to trigger an invoice mechanism from a payment by results system. That's the presentation complete. I welcome any questions.
Cliff, thank you very much indeed for that presentation. I think it's very interesting how an engineer adapts a safety product, in the sense of originally it was created to destroy needles from syringes and avoid stick injuries, which are prevalent amongst healthcare professionals. And then it's adapted to create data for public health, so that regions and countries are able to keep track of which individuals have been vaccinated. And it's easy to understand how valuable this is. As somebody who's an asthmatic and I have annual flu injections, because I advise a hospital, in London, I get my flu jab from the hospital, and have found that my medical records have no knowledge of my having had flu injections over the last 5 years, because the systems are simply not connected, whereas this is providing real-time information to public health and healthcare systems to allow us, hopefully, to emerge from the pandemic as soon as possible with safety that we know people have received vaccinations. So Cliff, thank you very much.